Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of women, continuing with the letter C, part 2. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, ears, eyes, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, and bladder, and then ailments specific to women and then specific to men, then issues of the hormones and the metabolism, and then issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mirror people tend to be pear-shaped and have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of women, continuing with letter C, part 2. Between puberty and menopause, a span of approximately 35 years, a woman ovulates about 400 times, normally at intervals of 28 days. If an egg is fertilized, pregnancy follows. If not, menstruation occurs as the vascular lining of the womb is shed. The cycle of fertility is maintained by 3 hormone-producing glands, the hypothalamus, pituitary, and ovaries. The ovaries produce 2 hormones, estrogen and progesterone, in response to 2 hormones produced by the pituitary, which are follicle-stimulating hormone, FSH for short, and luteinizing hormone, LH for short. Estrogen levels respond to FSH levels, rise dramatically in the 12 days leading up to ovulation, and are at their lowest during menstruation. Levels of progesterone secreted in response to LH are highest after ovulation, preparing the lining of the uterus, the endometrium, for implantation of the egg. Menstrual bleeding begins approximately 2 days after estrogen and progesterone secretions reach their lowest levels. About 1.5 ounces of blood are then lost over 3 to 7 days. The uterus or womb is a thick-walled, pear-shaped organ about 3 inches long with a narrow neck or cervix at its lower end. The mouth of the cervix juts into the top of the vagina. Opening into the bulbous upper end of the uterus are 2 tubes, about 4 inches long, called the fallopian tubes. The fallopian tubes are lined with tiny waving hairs that transport eggs from the ovaries to the uterus. It is in one or the other of the fallopian tubes that fertilization usually occurs. There is no direct connection between the ovaries and the fallopian tubes. Eggs are simply released into the fluid-filled peritoneal cavity and wafted towards the fringed entrances to the fallopian tubes. The ovaries themselves are almond-shaped and about 1.5 inches long. At birth, they contain many millions of immature eggs and follicles, but as already mentioned, only about 400 of them ever reach maturity. Although several eggs may begin to mature each month under the influence of FSH, however, usually only one egg totally matures. Once it has been released from its follicle, the follicle turns into a corpus luteum, literally yellow body, and proceeds to secrete large amounts of progesterone. The external female genitals, referred to as the vulva, consist of the fleshy inner and outer labia or lips that conceal the entrance to the vagina, and the clitoris, which lies just above the urethral opening, where the inner labia meet. The clitoris is very sensitive and a focus for many of the sensations that trigger orgasm. The vagina is about 4 inches long, and it expands and lubricates during sexual arousal, and is most sensitive near its entrance. It is protected from infection by populations of acid-producing bacteria. Breast development is one of the first signs of puberty in women. The breasts move with the pectoral muscles underneath, and their hang is greatly influenced by posture and the tone of the muscles that brace the shoulders back. Embedded in the fatty tissue of each breast are 15 to 20 clusters of milk-producing glands whose ducts converge on the nipple. The pigmented area around the nipple, called the areola, contains glands that keep the nipple supple. Cervical problems. Cervical problems are often discovered during a routine checkup rather than as a result of obvious symptoms. Checkups involve a manual or visual examination of the vagina and a cervical pap smear, which involves taking a few cells from the mouth of the cervix for analysis. The current medical opinion is that all women should have pap tests, smear tests within 1 year of becoming sexually active, and then at yearly intervals until the age of 65 to 70. More frequent, even yearly tests are recommended if the woman or her partner has many sexual partners, has vulval warts, smokes heavily, or has had a previous abnormal smear. Cervical dysplasia. Cervical dysplasia occurs just occasionally when the delicate tissue around the tip, or of the cervix erodes, reverts to a tougher tissue type of the lining of the vagina. Certain cells become abnormal and may eventually cause cancer of the cervix. To minimize risk of malignant change, suspect tissue is surgically removed or destroyed by laser or cauterization. In some cases, and certainly if cancer is already present, a hysterectomy is advised. Cervical dysplasia is likely to be symptomless, although its precursor, cervical erosion, may not be homeopathic treatment is constitutional. Cervical erosion. Cervical erosion is signaled by watery bleeding after intercourse or between periods. The cause is the extension of the delicate mucus-secreting lining of the cervical canal to the outer part of the cervix during or after pregnancy, or as a result of taking oral contraceptives. In itself, this condition is harmless, although it makes the mouth of the cervix more vulnerable to infection. If the discharge is heavy, cauterization of affected tissue may be recommended. Constitutional homeopathic treatment is advised, but in the meantime, the following remedies may lessen the discharge and clear up any infection. Specific remedies to be taken 4 times daily for up to 14 days. Burning discharge worse during the day, especially in the afternoon. Use Alumina 6C. Profuse smarting discharge with bleeding after intercourse. Use Phosphorus 6C. Bloody discharge, lower abdomen feels heavy and sore, intercourse painful. Use China 6C. Copious discharge between periods, feeling drained and weak. Use Cocculus 6C. Brown watery discharge with strands of mucus in it. Use Nitric Acid 6C. Discharge milky and itchy. Use Calcarea 6C. Cervical polyps. Cervical polyps are grape-like outpouches of the lining of the cervical canal that occasionally bleed after intercourse, between periods or after menopause, or increase menstrual bleeding. The discharge is usually heavy and watery. Since cancer of the cervix produces similar symptoms, ask your doctor to investigate. Surgical removal of polyps is a quick, painless procedure, but a D&C may also be necessary to exclude possibility of more serious causes of bleeding. Specific remedy to be taken 4 times daily for up to 14 days. Before or after surgical removal of polyps, use Calcarea 6C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.